We start with a group of poses that are helpful for a number of joints. They reappear in each of the latter chapters, so taken together, these all-stars make up an excellent assortment of asana for people who have mild generalized arthritis or who want to avoid acquiring any significant joint limitation in the future. For those who would prefer a Sanskrit name for this group, may we suggest Mukhya Artha or Sarva Artha, all-purpose or primary purpose. Tadasana. This is to establish well-aligned posture and stillness that will apply to all standing poses. Contraindications: severe imbalance, plantar fasciitis. There are no props for this pose. Because one's posture is habitual, extra care is needed to refine this most basic standing pose. Use a mirror to observe your alignment from the side and front. Common errors: pushing the pelvis too far forward, flattening the lower back, slumping the chest. Try to maintain a vertical plumb line through your whole body, from ankles to knees to hips to shoulders to ears. Respect the natural curves of the spine. Tadasana, Urdhva Hastasana. Inhale and lift your arms out to the side and up to your ears. Make a sweeping movement that stretches your ribs and sides. And as you move, the top of the arms stay close in to the shoulder, but the hands and forearms reach out. Exhale as you lower the arms back to your sides. Repeat this several times, following the natural rhythm of your breath. Another variation is Tadasana Urdhva Baddha Hastasana. Repeat the sweeping movements as above to raise your arms. Interlace your fingers and turn the palms up. Extend strongly and equally down into the earth and up to the sky. Set the humeri firmly into the shoulder sockets and the elbows as straight as possible. Breathe easy and fully. This pose provides a full stretch of the shoulders, the arms, and the hands. Standing lunge with wall. This is to learn pelvic and leg alignment and stretch the Achilles tendon and plantar fascia, to extend and flex the hips and knees. Contraindications would be Achilles tendonitis or bursitis, a torn meniscus, plantar fasciitis, or anterior cruciate ligament. Props: a mat and a wall. Make sure the pelvis stays square to the wall and the feet parallel, the forward knee over the ankle and the back thigh lifted away from the floor. Bear your weight equally over the four corners of the feet and lift the arches. Adho Mukh Svanasana series. This is to extend the spine and stretch the chest and the hamstring muscles. The partial inversion in the full pose often strengthens the arms and thoracic spine. Contraindication: acroclavicular dysfunction, rotator cuff tear, thoracic outlet syndrome, severe osteoporosis, carpal tunnel syndrome. Props: a yoga mat, blanket, wall, and maybe a tabletop. Retract the shoulder blades firmly onto the back ribs, and do not let the upper arms sag downward. Roll the biceps upward to maintain outward rotation of the arms. Balance the hands and feet on their four corners. Keep the knees bent if you're stiff, in order to be able to tip the pelvis so the spine can lengthen. Here we'll see 3 stages of the pose: puppy, arms against the wall, and classic downward dog. Utthita Parsvakonasana. To strengthen the hips and stretch the hips, leg, and spine. Contraindications: imbalance, plantar fasciitis, anterior cruciate tear, patellofemoral arthralgia. Props: a yoga mat, a wall, and maybe a block. The leg may collapse, and we're talking about the back leg. The front knee may misalign. Use a block for the hand that goes to the floor if your hips are stiff. Here we have 3 variations. Utthita Trikonasana. To strengthen and stretch the legs, hip, and spine. Contraindications: imbalance and pubic fracture. Props: a yoga mat, a wall, and a block. The wider your stance, the more freedom you will have in the hips. but do not go so wide as to lose stability. The knees may want to bend and the upper body tends to shift forward. Keep your legs straight and your torso lined up directly above your legs and parallel to the wall behind you. Prasarita Padottanasana. To stretch the adductors, hamstring muscles, gluteus maximus, and spine, and invert the upper body. This wide open standing pose helps to develop stamina and self-assurance. Contraindications: imbalance and ankle sprain. Props, a yoga mat, and maybe 2 blocks. Balance the weight on the 4 corners of the feet. Avoid tipping your hips back. Breathe with ease and fullness. Even when the arms are hanging down, pull them into the shoulder sockets. Standing lunge with chair. This is to extend the hip, strengthen the quadriceps, stretch the iliopsoas, the pectoralis, the latissimus dorsi, and the teres major muscles, and promote balance. Contraindications: hyperlordosis and severe lumbar stenosis. Props, a yoga mat and a chair. Set the pelvis carefully, squarely facing the back of the chair, and keep it that way as you perform the pose. Do not let the back leg droop. Align the front knee with the second toe. Here's an Utkatasana variation. The purpose is to strengthen the thigh abductors and shoulder adductors, and widen the thighs and pelvis without widening the lower legs, and to repair and maintain the hip joints. Contraindications would be severe hypertension, colostomy, and hemorrhoids. Props, a chair, and a belt. Take care in the placement of your legs. Press into the sides of the upper shins firmly enough with your hands to balance the strong outward push with your thighs. Keep breathing. Chair twist. The purpose is to rotate the spine, mobilize its joints, and learn how to stabilize the pelvis while twisting. Contraindications: herniated cervical or lumbar nucleus pulpus, total hip replacement. Prop, a chair. Avoid working the arms and neck to achieve the twist. Keep the pelvis and legs stable and aligned as instructed. Here's a variation of Ekapada Raja Kapotasana, or wall quad stretch. The purpose here is to extend the hip and stretch all 4 of the quadriceps, 1 leg at a time. Contraindications would be prepatellar bursitis, knee effusion, and hyperlordosis. Props, a chair, 1 or 2 folded blankets, and a pad. Keep the pelvis squared to the direction you are facing. Do not let one hip go backward or forward. Line up each leg from hip to knee to ankle. Lotus prep with wall. The purpose is to stretch the hip and outer thigh, the iliotibial band, expanding range of motion in a position that keeps the spine elongated. Contraindications: cerebrovascular disease, severe hypertension, colostomy, gastric reflux, medial meniscule tears, lateral collateral ligamentous sprain, severe joint effusion. Props, a yoga mat and a wall, a blanket under your head for comfort if needed. Hold the pelvis flat on the floor and evenly place left to right. Keep the foot of your crossover leg flexed to protect your knee. You may find that you are tighter on one side than the other. Move farther away from the wall when crossing over with the tighter side. The windshield wiper. The purpose here is to internally rotate the hips, 1 at a time, to stretch the side of the body, and to encourage full relaxed breathing. Contraindications would be a total hip replacement. A prosthetic hip should not overly adduct. Colostomy or herniated lumbar disc. Props, a yoga mat, possibly a blanket under your head for comfort. Be sure to start with your legs wide apart and adjust the position of your arms for comfort. Setu Bandhasana. The purpose is to extend and strengthen the back of the body and open the chest and the shoulders, extending the spinal range. Contraindications: absolute Chiari malformations, relative sacroiliac joint derangement, scoliosis, facet syndrome, spinal stenosis, vertebral fracture, severe osteoporosis, risk of fracture. Props, a yoga mat and a blanket. Keep the legs and feet parallel. Relax your neck, throat, and jaw as you breathe. If your neck is stiff, begin with a folded blanket under your shoulders and upper arms as shown. Avoid squeezing the buttocks too tightly. Sapta Padangusthasana. The purpose is to stretch hamstrings, paraspinal and quadratus lumborum muscles, reduce spondylolisthesis and lordosis, and improve pelvic alignment. This pose increases poise and equanimity while coordinating and loosening core joints. Contraindication: gastroesophageal reflux, hamstring sprain. Props: a yoga mat, a belt, and a blanket. Keep the muscles of both legs firm and active, and the pelvis steady as the leg changes position. Relax your neck, face, and shoulders, and breathe smoothly. Jathara Parivartanasana. The purpose is to mobilize the joints of the spine, to strengthen transverse and oblique abdominal muscles, to stretch the front of the shoulder and strengthen the back. Contraindications: total hip replacement, colostomy, herniated nucleus pulpus. Props: a yoga mat, blanket for optional comfort. Keep your muscles firm and do not do a floppy version of this pose. Align your spine down the center of your mat. Here's a plank series. The purpose is to strengthen the core abdominal muscles and the shoulders. Contraindications: colostomy, ileostomy, extreme hypertension. Prop: a yoga mat. Avoid rounding your upper back towards the ceiling, raising the hips too much or not enough, or dropping the head too low. The body makes one straight line in the plank. There are different variations that we can try. As you see, we can start in Sphinx and then move up to the forearms and then come into full plank. Bhujangasana. The purpose is to strengthen and extend the upper back and neck. Contraindication: fused ankylosing spondylosis, Chiari malformations, bridging spondylitis, cervical spinal stenosis. Props: a yoga mat and a blanket. Keep your shoulders back and do not overuse your arms. If you get up into the pose and find your shoulders around your ears and your chest collapse, come down and start over. This pose is about expanding the inside of you and supporting yourself with the muscles of your spine. Janu Shriyasana. The purpose is to stretch hamstrings, the glutei, and the quadratus lumborum muscles, to stretch, relax the back, and improve hip flexion. Contraindications: colostomy, hamstring spasm or sprains. Props: a yoga mat, an optional blanket, and a belt. Keep the straight leg firm and press the back of the knee down. Move the upper body forward more than down. Bend forward from the hips as symmetrically as possible. Aim the navel towards the inner thigh of the straight leg. Balasana. Purpose: to passively flex the lumbar and extend the thoracic spine and flex the hips, to prepare for relaxation. Contraindications: colostomy, prepatellar bursitis, total knee prosthesis. Props: a yoga mat and a blanket or two, possibly washcloths for the knees. If your knees are stiff, put folded washcloths behind your knees to create space and reduce compression there. Savasana. The purpose: to relax, assimilate, cease effort, and consolidate gains from all the poses you have done. This pose is essential in making a safe and meaningful transition between the practice of the poses and the rest of your life. Contraindications: late pregnancy, otherwise dying is perfectly safe. Props: a yoga mat, 2 or 3 blankets, possibly eye cover. After the initial setup, avoid fussing and fidgeting, become settled. Mr. Iyengar says that this is the most difficult pose.